Question 1. A 68-year-old male presents with acute exacerbation of chronic obstructive pulmonary disease, COPD. The physician documented COPD exacerbation. A. J44.0, J44.1. B. J44.1. C. J44.9, J44.1. D. J44.0. Answer: B. J44.1. This question tests your knowledge of combination codes, specifically for COPD with acute exacerbation. The keyword exacerbation indicates that a single code exists for both the chronic condition and its acute worsening. The ICD-10-CM guidelines state that J44.1 is the correct combination code for COPD with acute exacerbation, encompassing both conditions. For example, if a patient has chronic asthma that suddenly worsens, you would look for a single code that captures asthma with acute exacerbation. Always look for a combination code when a chronic condition has an acute manifestation or complication, as this provides the most specific and complete coding. Question 2. A patient is admitted for a fractured right ankle sustained in a fall at home. The fracture is described as a closed, displaced trimalleolar fracture of the right ankle, initial encounter. A. S82.851A, W19.XXXA, Y92.009. B. S82.851A. C. S82.851A, W19.XXXA. D. S82.851A, W00.XXXA, Y92.009. Answer: A. S82.851A, W19.XXXA, Y92.009. This scenario requires coding for an injury, including the external cause and place of occurrence. The core concept here is that injury coding often requires multiple codes: the injury itself, the external cause, and sometimes the place of occurrence. Initial encounter is a key clue, indicating the appropriate seventh character. The fracture code S82.851A identifies the specific trimalleolar fracture of the right ankle, initial encounter. The external cause code W19.XXXA describes an unspecified fall, and Y92.009 specifies the home as the place where the injury occurred. Remember, for injuries, you typically need to capture the injury, how it happened, and where it happened for comprehensive reporting. Question 3. A patient with known metastatic lung cancer presents with severe pain in the left hip due to pathological fracture. Imaging confirms metastatic bone cancer to the left femur. The primary lung cancer is still active. A. C79.51, C78.00, M84.58XA. B. M84.58XA, C79.51, C78.00. C. C78.00, C79.51, M84.58XA. D. M84.58XA, C79.51, C78.00, are 52. Answer: B. M84.58XA, C79.51, C78.00. This question tests the sequencing of codes for malignancy and pathological fractures. The primary concept is that when a patient has a pathological fracture due to a secondary malignant neoplasm, the pathological fracture code should be sequenced first. The keywords pathological fracture and metastatic bone cancer indicate this specific guideline. M84.58XA is the code for the pathological fracture, followed by C79.51 for the secondary malignant neoplasm of bone, metastatic site, and then C78.00 for the primary malignant neoplasm of the lung. Think of it this way: what is the immediate reason for the encounter? The fracture. The cancer is the underlying cause. Question 4. A patient with type 2 diabetes mellitus presents with diabetic retinopathy with macular edema. A. E11.31, H35.32. B. E11.31. C. E11.9, H35.32. D. H35.32, E11.31. Answer: B. E11.31. This question assesses the use of combination codes for diabetes with complications. The key concept is that ICD-10-CM often provides single combination codes for diabetes and its associated complications. The phrase diabetic retinopathy with macular edema clearly indicates a specific complication directly linked to diabetes. E11.31 is the combination code for type 2 diabetes mellitus with diabetic retinopathy with macular edema, covering both the underlying condition and its specified complication. Always check the tabular list carefully for combination codes under the diabetes category, as this simplifies coding and ensures accuracy. Question 5. A 45-year-old female presents for a routine mammogram as part of her annual screening for breast cancer. She has no current signs or symptoms of breast disease. A. Z12.31. B. N63.21. C. Z00.00. D. R92.8. Answer: A. Z12.31. This question tests the appropriate use of Z codes for screening encounters. The core concept is that when a patient receives a service for screening purposes and has no signs or symptoms, a screening Z code is used. The keywords routine mammogram and annual screening specifically point to a screening encounter, not a diagnostic one. Z12.31 is the correct code for encounter for screening for malignant neoplasm of breast, indicating that the patient is being checked for a condition they do not currently have symptoms of. Remember, if a patient is undergoing a test because of a known problem, it's diagnostic, not screening. Question 6. A patient is prescribed warfarin for atrial fibrillation and presents with bruising and a prolonged INR due to the warfarin. The physician documents adverse effect of warfarin. A. D68.32, I48.91, T46.8x5A. B. T46.8x5A, D68.32, I48.91. C. T46.8x5A, I48.91. D. I48.91, T46.8x5A, D68.32. Answer: B. T46.8x5A, D68.32, I48.91. This scenario requires proper sequencing for an adverse effect of a drug. The concept is that an adverse effect, which is a therapeutic dose causing an undesirable effect, is coded first, followed by the manifestation and then the condition being treated. The key phrase adverse effect of warfarin directly points to this guideline. T46.8x5A for adverse effect of anticoagulants is sequenced first, followed by D68.32 for the prolonged INR and bruising, bleeding disorder, and then I48.91 for the atrial fibrillation. This sequence clearly shows the drug reaction as the primary reason for the encounter. Question 7. A patient presents to the emergency department after accidentally taking too much of their prescribed opioid pain medication. The physician documents opioid overdose, accidental. A. T40.2x1A, F11.10. B. T40.2x1A. C. T40.2x4A, F11.20. D. F11.20, T40.2x1A. Answer: B. T40.2x1A. This question tests the coding of poisoning, specifically an accidental overdose. The critical concept here is that poisoning refers to an overdose, wrong substance given or taken, or intoxication, and these codes include the intent. The keywords too much and accidental directly indicate an accidental poisoning. T40.2X1A is the correct code for accidental poisoning by other opioids, which covers the overdose itself. When a poisoning is involved, the poisoning code encompasses the substance and the intent, making it the principal diagnosis, and often no additional code for the substance use disorder is needed unless specifically documented as abuse or dependence. Question 8. A patient is seen for recurrent headaches, nausea, and blurred vision. After evaluation, the physician diagnoses the patient with a migraine with aura. A. R51, R11.0, H53.8. B. G43.109. C. G43.109, R51, R11.0, H53.8. D. R51, G43.109. Answer: B. G43.109. This question highlights the guideline regarding coding symptoms versus a definitive diagnosis. The core concept is that when a definitive diagnosis has been established, you should not code the symptoms that are components of that diagnosis. The phrase, after evaluation, the physician diagnoses the patient with a migraine with aura is the key clue, as it provides a specific, confirmed diagnosis. G43.109 is the code for migraine with aura, without intractable migraine, without status migrainosus. Coding the symptoms, headaches, nausea, blurred vision, in addition to the confirmed diagnosis would be incorrect and redundant, as these are typically part of the migraine presentation. Question 9. A patient is admitted with acute systolic heart failure due to hypertensive heart disease. A. I50.21, I11.9. B. I11.0, I50.21. C. I11.9, I50.21. D. I50.21, I11.0. Answer: B. I11.0, I50.21. This question tests the sequencing of hypertensive heart disease with heart failure. The concept is that when hypertension and heart failure are linked, as in hypertensive heart disease with heart failure, a combination code for the hypertension and heart disease is sequenced first, followed by a code for the type of heart failure. The keywords hypertensive heart disease and acute systolic heart failure necessitate using both codes. I11.0 is the combination code for hypertensive heart disease with heart failure, which should be sequenced first. Then, I50.21 identifies the acute systolic, congestive, heart failure. This sequence correctly identifies the underlying hypertensive condition causing the heart failure. Question 10. A 75-year-old patient with Parkinson's disease presents with a history of falls due to unsteady gait. The physician notes the patient is at high risk for future falls. A. G20, R26.89. B. R29.810, G20. C. R26.89, G20. D. Z91.81. Answer: B. R29.810, G20. This question focuses on sequencing codes for an underlying condition causing an unsteady gait and risk of falls. The primary concept is that when the unsteady gait is a manifestation of an underlying neurological condition like Parkinson's, the code for the risk of falls or unsteady gait is sequenced first, followed by the underlying condition. The keyword history of falls due to unsteady gait and Parkinson's disease are crucial. R29.810 is the code for falls, history of, and is appropriately sequenced first as the reason for the encounter, followed by G20 for Parkinson's disease. This indicates that the falls are a current concern related to the patient's underlying chronic condition. Question 11. A 6-year-old child presents with otitis media, acute, suppurative, right ear. A. H66.001. B. H66.011. C. H66.41. D. H65.01. Answer B. H66.011. This question tests the specificity of coding for otitis media, including laterality and type. The core concept is that codes should be assigned to the highest level of specificity documented. The keywords acute, suppurative, and right ear all demand a very specific code. H66.011 represents acute suppurative otitis media, right ear. Failing to include the laterality or the specific type of otitis media, suppurative, would result in an inaccurate and less specific code. Always drill down in the ICD-10-CM alphabetic index and tabular list to find the most precise code that reflects the full clinical documentation. Question 12. A patient presents for evaluation of chronic, intractable low back pain. The physician notes degeneration of lumbar intervertebral disc. A. M51.36, G89.29. B. G89.29, M51.36. C. M51.36. D. R10.2. Answer B. G89.29, M51.36. This question tests the sequencing of pain codes with a definitive underlying condition. The core concept is that when documentation indicates a definitive diagnosis for the pain, and the pain is identified as chronic and intractable, the pain code is typically sequenced first. The keywords chronic, intractable low back pain indicate the need for a pain code as the principal diagnosis if the patient is seen primarily for pain management. G89.29, other chronic pain, is appropriate and is sequenced before M51.36, other lumbar intervertebral disc degeneration. If the encounter was for the treatment of the disc degeneration and the pain was just a symptom, the degeneration code would be first. Question 13. A patient is admitted for a stage 3 pressure ulcer of the sacrum. A. L89.153. B. L89.150, L89.153. C. L89.159. D. L89.153, L89.159. Answer A. L89.153. This question tests your ability to code pressure ulcers based on their stage and location. The core concept is that pressure ulcer codes are highly specific, incorporating both the anatomical site and the stage of the ulcer. The terms stage 3 and sacrum are critical identifiers. L89.153 is the correct code for pressure ulcer of sacral region, stage 3. It's important to never code an unspecified pressure ulcer when the stage is documented, and always include the specific location. Question 14. A 32-year-old pregnant patient, 28 weeks gestation, presents for a routine prenatal visit with no complications. A. Z34.02. B. Z34.00. C. O09.90. D. Z34.02, Z3A.28. Answer D. Z34.02, Z3A.28. This question tests the coding of routine prenatal care, including the specific week of gestation. The main concept is that routine prenatal care is coded with a Z code, and for encounters after the first trimester, an additional code for the specific week of gestation is required. The keywords routine prenatal visit and 28 weeks gestation are crucial. Z34.02 is the code for encounter for supervision of normal pregnancy, second trimester. Z3A.28 is then added to specify the 28th week of gestation. Always remember to capture the specific week for these encounters, as per the ICD-10-CM official guidelines. Question 15. A patient presents for follow-up of a non-healing surgical wound of the abdomen after a laparoscopic cholecystectomy. The physician documents non-healing post-op surgical wound, abdominal. A. T81.89XA, K82.9. B. T81.89XA, Z98.89. C. T81.89XA. D. L08.9. Answer: C. T81.89XA. This question tests the coding of a non-healing surgical wound as a complication. The core concept is that complications of surgical and medical care often have specific T codes, which are assigned even if the complication is the reason for the encounter. The phrase non-healing surgical wound indicates a complication directly related to the prior surgery. T81.89XA is the correct code for other complications of procedures, not elsewhere classified, initial encounter. While other codes might seem related, this T code specifically identifies the complication. It's important to distinguish between routine follow-up and follow-up due to a complication. Question 16. A patient with a history of acute anterior wall ST elevation myocardial infarction, STEMI, 5 weeks ago is admitted today with chest pain. Physician documents post-MI chest pain. A. I21.01, I23.8. B. I25.2. C. I21.01. D. I22.0. Answer: B. I25.2. This question tests the coding of old or healed myocardial infarction, MI, versus a subsequent acute MI. The key concept is that after a 4-week period, an acute MI becomes old or healed for coding purposes, unless a new acute MI has occurred. The phrase 5 weeks ago for the acute MI, combined with the current chest pain, indicates that the current encounter is for an old MI, not a new or subsequent acute MI. I25.2 is the code for old myocardial infarction, used when an MI has occurred in the past and the patient is no longer receiving care for the acute phase. Don't confuse subsequent encounter for an injury with subsequent MI. Question 17. A patient with chronic kidney disease, CKD, stage 4 presents with anemia. The physician documents anemia in CKD stage 4. A. N18.4, D63.8. B. N18.4, D61.2. C. D63.8, N18.4. D. D64.9, N18.4. Answer: C. D63.8, N18.4. This question tests the sequencing of codes for anemia in chronic kidney disease. The core concept is that when anemia is present as a complication of chronic kidney disease, the anemia code is sequenced first, followed by the CKD code. The phrase anemia in CKD stage 4 explicitly links the two conditions. D63.8 is the code for anemia in chronic kidney disease, and it should be sequenced first as it represents the manifestation being addressed. N18.4 for chronic kidney disease, stage 4, is then sequenced second as the underlying cause. Question 18. A 5-year-old child swallowed a button battery yesterday. The battery is still in the esophagus. The patient is admitted for removal. A. T18.120A, Z00.00. B. T18.120A, X58.XXXA. C. T18.120A, W44.B0XA. D. W44.B0XA, T18.120A. Answer: C. T18.120A, W44.B0XA. This question requires coding for a foreign body in the digestive tract, with an external cause code. The primary concept is that when a foreign body is ingested, the foreign body code is primary, followed by the external cause code. The keywords swallowed a button battery and still in the esophagus identify the specific foreign body and its location. T18.120A is the code for foreign body in esophagus, button battery, initial encounter. W44.B0XA is the external cause code for battery entering into or through natural orifice, accidental, which explains how the injury occurred. Remember that foreign body ingestion often requires an external cause code to provide context. Question 19. A patient is homeless and frequently misses follow-up appointments due to lack of transportation and stable housing. A. Z59.0, Z59.4. B. Z59.0, Z59.4, Z91.A4. C. Z59.0. D. Z59.4. Answer: A. Z59.0, Z59.4. This question addresses coding for social determinants of health, SDOH. The concept is that Z codes are used to document factors influencing health status and contact with health services, including social problems. The phrases homeless and lack of transportation and stable housing are direct indicators for SDOH codes. Z59.0 is for homelessness, and Z59.4 is for lack of adequate food and safe drinking water, which often accompanies unstable housing and transportation issues. It's important to capture these codes when they impact a patient's care and health outcomes. Question 20. A patient presents to the urgent care clinic with a cough and fever, confirmed to be due to acute bronchitis. A. J20.9, R05, R50.9. B. J20.9. C. J40. D. R05, R50.9. Answer: B. J20.9. This question is about coding a definitive diagnosis and avoiding symptom codes. The core concept is that when a definitive diagnosis has been established, you do not code the symptoms that are an integral part of that diagnosis. The phrase confirmed to be due to acute bronchitis signifies that acute bronchitis is the specific diagnosis. J20.9 is the correct code for acute bronchitis, unspecified. Coding R05, cough, and R50.9, fever, in addition to J20.9 would be incorrect, as cough and fever are common symptoms of bronchitis. Question 21. A patient presents for a scheduled chemotherapy session for recurrent ovarian cancer. A. Z51.11, C56.9. B. C56.9, Z51.11. C. Z51.11, Z08.89. D. Z51.11. Answer: A. Z51.11, C56.9. This question tests the sequencing of codes for chemotherapy encounters. The main concept is that when a patient receives chemotherapy, the Z code for the encounter for antineoplastic chemotherapy is always sequenced first, followed by the code for the malignancy. The keyword chemotherapy session indicates the primary reason for the encounter. Z51.11 is the correct code for encounter for antineoplastic chemotherapy, and it is listed before C56.9 for malignant neoplasm of unspecified ovary. This sequencing prioritizes the service being rendered, chemotherapy, over the condition itself. Question 22. A patient with a history of alcohol dependence in remission presents with symptoms of acute alcohol intoxication after a relapse. A. F10.20. B. F10.129, F10.20. C. F10.129. D. F10.229. Answer, D. F10.229. This question tests the specific coding for alcohol dependence with intoxication during remission. The core concept is that ICD-10-CM has specific codes to indicate substance dependence with intoxication, even if the patient was previously in remission. The keywords alcohol dependence in remission and acute alcohol intoxication after a relapse are critical. F10.229 is the code for alcohol dependence with intoxication, unspecified. The prior remission status becomes part of the history, but the current state is dependence with intoxication. Question 23. A patient presents with a laceration to the right eyebrow, sustained from falling off a bicycle. The wound was irrigated and sutured. This is the first time the patient is seen for this injury. A. S01.11XA, V18.0XXA. B. S01.11XA, V18.0XXA, Y92.830. C. S01.11XA. D. S01.11XA, W06.XXXA. Answer, A. S01.11XA, V18.0XXA. This question requires coding for a laceration and its external cause. The core concept is that traumatic injuries require an injury code and an external cause code to fully describe the event. The keywords laceration to the right eyebrow, falling off a bicycle, and first time the patient is seen guide the selection of the injury code and the appropriate seventh character. S01.11XA is for laceration without foreign body of right eyelid and periocular area, initial encounter. V18.0XXA is the external cause code for pedal cycle driver injured in non-collision accident, which explains how the injury occurred. Question 24. A patient is seen for routine follow-up after a successful surgical repair of a right inguinal hernia 1 month ago. No complications are present. A. Z09. B. Z09, Z98.89. C. K40.90. D. Z08. Answer, A. Z09. This question tests the use of Z codes for follow-up care after treatment for a disease. The core concept is that Z09 is used for follow-up visits when the initial treatment is complete and there are no current complications. The keywords routine follow-up and successful surgical repair with no complications are crucial indicators. Z09 is the code for encounter for follow-up examination after completed treatment for conditions other than malignant neoplasm. It correctly reflects that the patient is returning for a checkup, not for treatment of an active problem or complication. Question 25. A patient with a history of intravenous drug use presents with endocarditis of the aortic valve due to methicillin-resistant Staphylococcus aureus, MRSA. A. I33.0, B95.62, F11.20. B. I33.0, B95.62. C. B95.62, I33.0, F11.20. D. I33.0. Answer, A. I33.0, B95.62, F11.20. This question tests the coding of infectious conditions due to a specific bacterial agent and associated substance abuse. The core concept is that when an infectious disease is caused by a specific organism like MRSA, the infection code is primary, followed by the organism code, and then any associated conditions like substance dependence. The phrases endocarditis of the aortic valve, due to methicillin-resistant Staphylococcus aureus, MRSA, and history of intravenous drug use necessitate multiple codes. I33.0 is the code for acute and subacute infective endocarditis, followed by B95.62 for methicillin-resistant Staphylococcus aureus infection as the cause of diseases classified elsewhere. Finally, F11.20 for opioid dependence, unspecified, is added as the underlying risk factor often associated with intravenous drug use.